So good morning. I think we can start. I'll thank you for joining us in our international rounds today, and it's my great pleasure to introduce Farhan Ahmad, who is the CEO of the Pakistan Children Heart Foundation, which is an organization working towards building in Pakistan the first children hospital, a children heart hospital, and he is an advocate for helping children with congenital heart disease. And I think from this platform, we have an obligation to hear what are the needs for congenital heart disease around the globe. And Farham has been sharing his experience in Pakistan in many meetings, and I thought that it's super important that we support the low-income countries as much as we can from the resources countries. So Fahad, thank you very much for accepting the invitation, and the floor is yours.
Thank you very much, Rafa, and thank you very much, all of you. I really appreciate this Toronto ACHD forum to giving me chance to share the experiences and our work that has been done as of today regarding congenital heart issue in Pakistan. Thank you so much. So let's start with the presentation. So today I'm going to talk about our journey from charity to building a congenital heart center and what challenges we were facing, and we are expecting if the same needs to be done in any low and middle income countries. So Pakistan is a country based in South Asia. We are the world's 5th most populous country. The last year consensus shows that we are at 241 million people within 881,000 square kilometer spanning area. Also, our largest city is in Karachi. I am right now in Lahore, which is north side of Pakistan. So we'll start with a brief video, how I got involved into the congenital heart disease community. So it's a BBC video which they approached us in 2015, and they understood the cause, and they had done their contribution.
Muskan is 16 months old, and for 12 of those months, she's been waiting for a heart operation. She and her parents have traveled a long way from the remote tribal areas in the north to get to this private hospital.
She was born with a hole in her heart. Sometimes her nails would go blue, and so would her eyelids. She would scream and then faint. I have no job now, and we can't afford surgery. We heard about this charity in Lahore, and they said they'd help us.
Farhan Ahmad started the Pakistan Children's Heart Foundation 3 years ago. His charity has paired up with hospitals across the country and covers all operation fees through donations. He's taken on this cause for personal reasons.
My daughter was born with a congenital heart defect. It was very difficult for us to even find the doctor. It took us about 3 weeks for us to find out that she has a congenital heart defect. Today she is no more with us, but her memories has kept me and my family to take this initiative forward.
Muskan is one of 50,000 children born with congenital heart disease every year in Pakistan. But she will be among the very few who will undergo surgery and get treatment. Muskan is now being taken into the operating theater. For every child who gets heart surgery in a private facility, thousands of other children are waiting for a similar operation in government hospitals, and doctors here tell me some might actually die waiting. And this is why most of the children in this government hospital ward are in critical condition. Pakistan's public health system is overburdened with cases and severely underfunded. only 3% of the country's budget goes to health. In a population of nearly 200 million people, there are only 8 practicing pediatric heart surgeons.
We work in a public sector institution where we see 100 plus children coming to our institute every day. We can only offer surgery to 2 or 3 of them when 20 of them need surgery. And then you come into this equation of prioritization. And that priority of patients is sometimes which hurts you the most.
Back in the private hospital, Muskan's had a successful surgery. But the reality of Pakistan's poor healthcare system is that many other children may never get the treatment they need. Shaima Khalil, BBC News, Lahore.
So basically, this is how you have get an idea that how myself and my family got involved into the congenital heart issue. So the history goes back 2010. My little daughter Aisha, she was born with a severe congenital heart issue. She had challenges, multiple type of challenges. So she was born with pulmonary atresia, tricuspid atresia. So she had to go through a Glenn procedure. Myself, I own a technology company. By profession, I'm an accountant. We specialize in Microsoft implementation across the world. So there was no financial problem. However, getting access to the right cardiologist, the right cardiac surgeon was a big challenge. Then Aisha, her first procedure was done. She got BT shunt when she was 3 months old. Then in the hospital, she acquired infection, and then our stay, which was planned for a couple of days, had to be extended for about 2 weeks. So those 2 weeks actually turned a lot as far as our healthcare challenges in general were exposed to us. So that day onward, the first thing we did while Aisha was alive for 3 years, during her life, we started this foundation. So again, thank you very much, this forum, for giving me a chance to share what the current challenges we are facing and what challenges we are hoping to be taken care in the next future. So just to give you a health challenges issue in Pakistan, so we as one of the LMC countries struggled with all those diseases which generally are taken care very well in advanced countries, but we still have infectious diseases like malaria, dengue. Malnutrition is a big problem. Maternal and infant mortality is a big issue. Then non-communicable diseases is one of the things that we struggle every day. Then we have limited healthcare facilities, not only in rural areas, but also in major cities as well. So the way healthcare is divided, there is a public sector hospital network, and then there is a private sector hospital network. Then, of course, mental health challenges are there. Polio is one of those countries. It's not yet 100% eradicated. And of course, drug abuse, which is right now a big concern in the universities and the schools. Specifically talking about mother and child health issues, so malnutrition is one of the biggest problem, not only in rural areas, but also in metropole cities. Infant mortality, unfortunately, we are probably the second largest in the world. Immunization gaps, because of the myths, the social impact, we have to struggle a lot. It's not just the network, it's actually a lot of education required to the parents. So lack of parental care, parents are not aware of what needs to be done, especially if the child is born with some sort of serious health issue. Waterborne diseases are there, unfortunately, because safe water is a big problem. In cities, we have taken care about. In rural areas, it's still a big problem. Education is a big barrier because a lot of people are not educated. So whatever their elders have told them, they actually believe that that's the only way. And again, polio is one of the things that we are still struggling with. As I said, mortality rate, unfortunately for the newborn, we are second largest in the world. In 2019, still we are progressing. It's getting better day by day, but still we have a lot to cover. Our birth rate in general, if I give you some numbers, so we are struggling with approximately 6 million children born every year. So I'm going to take you to the real problem of congenital heart disease. So one out of every 100 child in the world is born with CHD. We believe in Pakistan, because of the malnutrition and other issues, probably this number is more. But since we don't have data, we will take the same 1 out of 100, and that turns out to be a 60,000 children born with congenital heart issues annually in Pakistan. Unfortunately, the whole country with the 241 million population, we have approximately 10 to 15 pediatric cardiac surgeons and 35 to 50 pediatric cardiologists in the whole country. One of the government hospital, which you might have noticed in the BBC video, there is a list of 15,000 plus children who are waiting for their heart surgery, but we don't have facility. So there is a huge lack of trained staff and infrastructure. So when we had this problem, so we did a detailed analysis, and there are a couple of things that we have found out that the biggest challenge is that the healthcare professionals are divided into two different sectors. So the same surgeon, the same team works in the morning with the private public facility, where they are not paid better or even equivalent to what a normal physician or a surgeon should be paid. But they all have to work in the evening with the private sector. So typically a pediatric cardiac surgeon life starts 7 a.m. in the morning, and they first have till 2 p.m. they work in public facilities, then they rush to the private sector. They start their surgeries at approximately 3:30, and then till like 8 9 p.m. that's how things work. So there is a huge lack of trained staff, and that's not only just the surgeons, but we have a challenge with the allied staff. For example, trained nurses, medical officers, perfusionists, and the whole team is, in fact, it's not there. The other thing is that the ICU setups, the post ICU care is something which we realize that that needs to be needs to be focused on. And one of the biggest problem is that we have lack of private sector involvement, because there are other heart diseases which mostly the private sector, because it's most of the money making sector for them, so they easily develop that. But for pediatric, however, for pediatric cardiac setup, it's a resource extensive activity. So a lot of public sector, private sector do not invest in it. And finally, there is a huge financial challenge. Like for even a middle class family, it's difficult to arrange $3,000 for an open heart surgery, and a cath procedure is approximately $2,000. Even to get a consultation and an echocardiography done, there's still approximately $30 to $50 required for the parent to go and talk to a physician. So who we are Pakistan Children's Heart Foundation, registered charity, tax exempted, PCP certified, Sharia compliant, and since 2012, we are focused on transparency, making sure that the public's funds are collected and spent the way the guidelines are provided by the authorities. One thing I would like to highlight, that we don't compromise on any audit firms. So top 4 audit firms, one of those is PwC. They are our auditor. So what is our vision? So what we are looking forward is that in Pakistan, not a single child born with congenital heart disease should remain untreated, because we believe that's the basic right of a child who is born with the CHD problem, to get access to the physicians community, and of course then get treatment. So what workable steps we did since inception? So first we focus on universal health coverage, which was there 3 years ago, started by the government of Pakistan. So there was no ped surgery included in that. So we did a lot of lobbying, some working, and now The pediatric cardiac surgery is part of the universal health coverage. The second thing that we have worked with is private insurance companies so that they can include the pediatric cardiac surgical setup and intervention in their the ecosystem. Then we have worked on peds cardiologists, and the way we work is we work through public sector hospitals and training centers. And then we have worked with especially the surgeons and the ICU nurses. And I'm going to show you in next few slides that how we have tried to contribute in not only building our own center, but at the same time expanding our horizon to the other center where the pediatric cardiac surgeries are happening. Then we didn't stop here. We believe that regional international collaboration is very, very important. So we are the only center in Punjab, Pakistan, who's registered and working with IQIC, which is a Boston Children's Hospital initiative for improving quality care in low-income countries. Of course, then neonatal screening and fetal echo is one of the things that we have worked with the local public sector hospital to develop these facilities, not only in Punjab, but other parts of Pakistan. And of course, this improving neonatal and early infant open heart surgery, because we as a country, I think we can fairly say that adult or a child with a age of 10 to 12, they can be treated in multiple centers, but infant and children below two years, that's a big issue for us to develop across the country. So there are 4 projects that we work on, and I'm going to show you in the next few slides. So our focus is to build the first center of excellence, Children's Heart Hospital and Research Center in Pakistan. Then we support multiple pediatric cardiac surgeries across different centers in Pakistan where people cannot afford the heart surgery. So we financially provide them support. The third thing, we work on Project Daniel, which is bringing medical mission from developed countries like yours in Canada, in US, Middle East, and then the doctors come and work with the local setups. And of course, raising awareness is one of the big problem, because a lot of people do not consider CHD a problem. So quickly, as of today, in Project Mohsin, which is where we sponsor different heart surgeries, so we have been able to support 3,791 surgeries and intervention across Pakistan starting 2010. Right now, 1.5 billion rupees have been spent on the heart surgeries. The mortality rate right now is 6.5%, and this is again comparable to any international standard. The thing that I would like to highlight that this percentage is low because we do not do a lot of complex cases. So majority ASD, VSD, tetralogy fellow, that kind of cases we sponsor. Since 2023, we have our own center which has operated 1,000 cases of our team. It's a rented facility. The second project, Daniel, where we bring medical mission. So we did 6 medical mission where 80 plus intervention and surgeries were done by the local team. And we did 5 medical workshops where we trained approximately 200 nurses, post-ICU staff, both places in Lahore and in Peshawar, which is, north side of Pakistan. Project awareness. So we work very closely on raising awareness. So Misbahul Haq is one of the country's popular figure in terms of cricket. He was the most successful captain. So he joined us in 2018. So through his Twitter account, through his circle of friends, we do a lot of CHD awareness. So we are very active in CHD month, which is especially the week that we observe from 7th February to 14th February. Then we have developed 3 programs. One is student ambassador program. We have professional ambassador program and corporate partnership program. So we go to different universities. We sign up with.
Sorry to stop you. Yes, we lost your slides.
Can you hear me?
We can hear you, but we lost your slides. We don't see
so the
slides.
slide is not.
Now they are
back.
They are back. Okay, perfect.
Okay. I'm gonna do this again. So Are you able to see the slide?
Yeah, they are perfect now. Thank you.
All right. Thank you. So what we did, we started funding surgeries, and in addition, we thought that we need to build our own pediatric cardiac surgery program at one of the rented hospital within Lahore. So we can work with other institution, but also till the time our hospital is built, we need to build our team so they are trained. So once the brick and mortar is complete, so we are not left with no team members, or we don't want to hire from other centers, so the other center may stop working, and then the whole team move here. So first thing we did, we in 2018 we together with the team identified that how the outpatient echo services to be improved. So we started our own OPD. Then we worked very closely with the other centers. So the referral comes to us, and then we build a cardiac catheterization program within our setup last year, and of course the surgery team and the ICU. The way we work again, very detailed collaboration with the institution like Boston. So their team came in. We worked with IQIC team a lot, and we were given last month an award for one of those centers who provide timely and accurate data. I'm going to talk about little more about our cardiac center at one of the private hospital, which is University of Lahore Teaching Hospital. So we started this in 2018, and as I mentioned before, we did not had a surgeon resign and join us full time. So what we did, we developed an ecosystem where out of those 6-7 surgeons that are currently based close to us, so we requested them that in the morning it's fine, you go with the public sector, but in the evening you don't give your whole 7 days to that center, start giving us 1 day. So that's how now these surgeons, they do whatever they want to do in the morning and the evening, but in the whole week now in our center we have divided their allocated time. So 2 days Dr. Salman comes in, 2 days Dr. Faiz come in, 1 day Dr. Asim comes in. So that's how we are able to achieve 1,000 cases starting 2018. As you can see that our focus was to build a team of professionals who, once our hospital is complete, are there to support. So we have about 35 medical professionals trained. We are very keen on focused on building our quality improvement programs. So as you can see that initially when we started only with ASD, then we moved to VSD, then slowly and gradually now we are able to do the tautology of fellow cases in our own center. If you look at the RAC 1 score, so you can see that 348 were won, and we have now started to do RAC 3 cases. Out of those 1,083 cases, we have mortality of about 3.2%, and all data is already shared with the IQIC. We did sign up with the universal health coverage, and out of those, half of the cases are in fact sponsored, not fully, but partially by our center government. So this is just a quick data of how different hospitals we work with. So if you look at, we are talking about approximately 10 to 12 departments or center across Pakistan where we are able to support the heart surgeries. And the graph is getting bigger day by day. Our focus is again to provide not only financial support, but help these institutions so that the doctors and the other facilities, they are also part of the ecosystem. So they don't leave the country because they don't have any financial support available. So there are centers in Karachi, there are centers in Multan, there are centers in Peshawar, there are centers in Rawalpindi. So we work across Pakistan where we support the children born with congenital heart disease by sponsoring their heart treatment. So I mentioned that we have a technology background. So there are a lot of dashboards which are available, and these are one of the reasons that the donors start trusting us. So look at the different kind of analysis. Which part of Pakistan majority of the TOF cases are coming in? Which part of Pakistan majority of the TJ is coming in? And number of surgeries by year, by month, by day, which is the most common procedure that we have performed. And right now, 39 patients are admitted. 3 million funding is still required, and 2 billion has already been spent. Then there are different types of other analysis available. What is the average age and illness count? What was target? What was achieved? Not only that, what type of procedure have been done? What was the age-wise illness diagnosed? So look at the numbers that the top where age is large, then the VSD where again the child is like maybe approximately I think 12 years old. So that's how we track all the data. This is where you can see the number of procedures that we have been sponsoring. These are all calendar data, and these are all like proactive dashboards. So we give access to our donors, and not only that, we give them access to the patient who got operated. So let's suppose anybody who sponsor a child with the parents' permission, we share their demographic data, that from which part of Pakistan the child you have actually sponsored. His parents' numbers are available if you want to talk to them, and there is a complete utilization report provided to the donor, so they feel very complete that the donation is spent on the right place. The bar is increasing day by day. Last year we did about 599, and right now we have done about 530. I think we should be able to done by December, maybe like 610, 615 cases. So we are proud, partnered with our different hospitals where we provide this financial support to these centers. So Project Daniel, I would like to quickly talk more about it. So we work with local pediatric cardiology and cardiac surgeons where there is not a full infrastructure available, or let's say if that center is lacking any specialized equipment, so we provide that equipment and ensure that they are able to achieve what they want to do. So there are different hospitals we work with. In Faisalabad, there was a light required from the surgeon, so we bought that. In other center, if there is a cardiology setup or anything required, like surgical center, any equipment, so we make sure that that's available there. So the way we work is that we identify different centers, then we meet with the stakeholders. We provide them, financial support, that what exactly is needed from our side. Do you need medical support or the financial support? Then we set up minimum criteria, and then we give them KPIs that, look, we are going to fund, let's say, 100 patients in the beginning, but at the same time, you need to develop a center. You need to commit at least 2 to 3 years of program. So where in any private center, we are going to fund the initial 100 or maybe 200, but later on, you need to build that facility on your own. And then we have a regular assessment of quality outcomes. Future partner, we are currently working with one center in Multan and one in Faisalabad. On the left side, these are all existing partners. We work very closely with Rotary. We are very proud of them. And we are also very, very proud of the people, especially in the North America, who and other parts of the world who support us, who believe in the cause. So this is the hospital thing that I'm now about to talk. So in 2021, we requested our partners that we need a land, so they donated us land. And right now, this is the picture on the bottom, that our gray structure is complete. So currently, we have spent approximately 695 million rupees, and we are still short of approximately 1.6 billion, which we are very keen in meeting our deadlines. We take this charity very seriously. It's not that we just we always have a backup plan of what can be done, what cannot be done. So this building is a 7-story building, 2 basement, ground plus 4. Each floor has a separate facility. So ground floor has OPD, the first floor has operation theater, the second floor is ICU, the third floor is private rooms. There will be 2 of OTs and 1 hybrid lab, and then we will have a 1 cath lab. Once this facility is complete, which will be Pakistan's first Children's Heart Hospital and Research Institute, we are going to have a facility where we'll be able to operate about 3,500 cases through 2,000 are surgeries and approximately 1,500 are intervention. We are very thankful to our partner organization, Pakistan Children's Heart Foundation North America. Dr. Ali Zadi is one of the ACHD known figure across the world. He is very, very supportive. Then we have Qasem, Dr. Kaisar Bashir, Asher. They are a registered charity in US. So the way we work, we request them grants, they evaluate the grants, then they transfer the money to us through online, and then they also provide facilities like donation in kind. And then the utilization report are sent back. So 3 times in a year, we travel to US, and now we have a registered charity in UK, and currently we had submitted paper in Canada. All of our financial statements are available on our website. We are certified by the local authorities, and PwC is our auditor. I think that's pretty much it. This was a brief overview of the kind of work that we are doing and currently what we have done as of now. So I'll open the room for questions.
Thank you. Excuse me. Thank you very much for taking us through this the journey and the life of people with congenital heart disease in Pakistan. So the floor is now open for questions, and people can either unmute their microphones or ask questions or make comments in the chat. So while people think about questions, so while I was listening to your talk, the first question that came to me is, what is the biggest challenge apart from is two questions I have. So what is the biggest challenge that you face? Is lack of resources, lack of human power altogether, and how we from the developed countries can help to overcome these challenges. How can we provide either education or I don't know, human resources is difficult, but how do you envision us helping you to achieve what I think needs to be achieved, which is a good care for these patients in low-income countries?
Okay, Rafa, thank you very much. Very good question. So I'll first answer the first question. So the biggest challenge is the infrastructure and, of course, the human manpower, the trained manpower. Because right now, the way we work with the North America team, a lot of people wants to go back and would like to contribute, so that they are able to train the local resources. But there is no infrastructure available. There's not a place available right now. So yes, there are two issues that we are currently dealing with. The first one is building the infrastructure, where from the developed countries, people can start coming in. We can develop exchange programs where our doctors and physicians can travel to these developed countries and get training, and people from there come and train our teams here.
Rafa, Ali, can I jump
yeah,
in?
I was about to call you in. So
Yeah. Hey, good morning, everybody. Salam for invite. So this is great, Rafa, that you invited Farhan to talk about this. And I think just as a background, you hit the nail on the head in really your question. There are two issues that Farhan highlighted. And Farhan, if you can just go back to the picture of the hospital that you had, I think it's slide 26 of yours. I can see it on the thing. There are really two issues, Rafa, in developed countries or developing countries. Is one, as you said, is infrastructure, lack of infrastructure. We do not have actually in lower middle income countries like Pakistan, infrastructure that's dedicated. And what happens, as Farhan highlighted, was that there are 8 or 10 cardiac surgeons in the entire country, and they're basically working off a private practice model, in essence, which basically means a kid comes in. If the kid's family has money or they have the resources, they will pay the surgeon. The surgeon will go to a hospital, could be any hospital. If the hospital has resources, they will get the kid operated and the kid moves on. So nothing really sort of that is dedicated. I'm not saying it's across the country. There are places in Karachi and Peshawar that have some resources and they are developing. So please don't get the impression that it is completely zero. It is absolutely not zero, but it is not as developed like we have here. So the first part is infrastructure. And what Farhan is doing with PCHF is exactly that, is that he's now developing this dedicated children's heart hospital, which is going to be 7 or 8 floors. And it is, if you think about it, it will be sort of like a freestanding congenital heart center that is almost unheard of in that part of the world. So that's one. So infrastructure. The second thing, Rafa, that you highlighted is human resource. And that, as Farhan also highlighted, is a huge issue. If you think about it, even here in the US or in Canada, you need dedicated surgeons and dedicated ICU docs and nurses and perfusionists. And I mean, just think of it. That doesn't even, that granularity doesn't exist. It doesn't exist well, it doesn't exist universally. So that has to be developed. So it has to be developed consistently. So I think those are your two biggest challenges. I'm going to end with just this. You said something very important, Rafa, is that how can other people help? And that's what Farhan was alluding to, is that what we're trying to develop, and I'm trying to help in some ways, is create resource allocation. Monetary is one thing, but actually human resources. So people go, like let's say it's from Toronto or New York or whatever, and they take mission trips. They go there, they teach, they create that knowledge base that is transferred from developed countries to the people on the ground, and you create that resource structure from a human. So you teach, you impart knowledge. And that is what Farhan has actually already developed. That's one of the, I forget, it's Project Mohsin or Daniel, I forget which one it is, but I think that is somewhere that's being done. So I'll stop talking. I know there are a couple of hands going up, but thank you again, Rafa, for this.
No. So that's my pleasure. I think that the points that you are making, Ali, are very valid, and I think that I strongly believe that we have an obligation from those that I feel privileged for working where I work, and we have an obligation to help as much as we can. There are some comments and questions in the chat, and after Erwin has a question as well. So Dr. Frodoraki from Greece. Hello, everybody from Greece. Hello, Alexandra. As I understand, there is a lack of both general cardiologists and congenital heart disease cardiologists. Or do you have just a problem with congenital heart disease? Or is a problem across the spectrum of specialists, or is just congenital heart disease?
I'm sorry, can you please repeat the question?
The question is, so Alexandra says that she believes, well, Alexandra, you are on mute and you are on camera, so
Hi.
I let you to drive.
Hi. Okay.
Nice to see you.
Hello, thank you very much, Dr. Farhan, for your excellent talk and inspiring, actually, talk. I would ask how many cardiologists you have, because educating cardiologists on congenital heart disease could be a first step towards the pathway to treatment for these patients. And that's what I would like to know. Of course, your work is amazing, and many congratulations. But I was thinking of other countries with low and middle income. Would they be able how to to screen for congenital heart disease, given the restraints in education, as you said, in food, in if you can go somewhere, I mean, you can not even travel in some countries. So if you have locally some more experts that they can pick up as a first screen, the congenital heart disease patients, children and adults, this could be the first step. Of course, it is very difficult because you have to think of the resources of the country and if it is possible to send them to another country for treatment. Thank you very much for your talk.
Thank you so much, Alexandra, for your valuable appreciation and wonderful question. So there are two parts of your question, and I would like to answer in detail. So the first thing is the number of cardiologists, peds cardiologists. So there are right now less than 50. So in the whole country, we have very, very few pediatric cardiologists and the centers where a patient can reach. The other part is
What
that
about, excuse me, Farhan, what about general cardiologists? Adult, I mean, you
okay,
have a lot?
so a
Because
lot,
in,
maybe like in thousands. Yeah.
so
So
this could be a target for awareness.
yes, so Alexander, two things we have done, and I think it's a very valuable feedback. So the first thing we did, we trained pediatricians from across Pakistan, and we did multiple sessions of them with the pediatric cardiologists. So they, in fact, have intimated them that you need to do two things immediately. The first thing is focus on the murmur sound, and the second, the pulse oximeter. So as soon as the child is born, if you believe that there are certain things which are not there, you refer it to the pediatric cardiologist. So that's the first thing that has been done from our side. In terms of raising awareness, so what we did, we have approached with all the centers, not only public, the private center where the babies are born. So we do a lot of educational session to them, saying that if a child has this kind of diagnosis which you believe may lead to a heart procedure, you can also refer it to us. The third thing is that, which is the biggest problem, which we started to do, is having our own screen camps in multiple parts of Pakistan, especially the rural areas. So to our surprise, so what we did, it's not just a typical medical camp. So initially, it's an effort of about a month or so. So in the local community halls, especially the religious places where people go to, and schools, we do like different announcements that if a child has following issues, there will be a team coming in on this particular date. So you come and get yourself screened. So we have a remote pediatric cardiac clinic available. So our team of physicians, along with cardiologists, peds cardiologists, so they go, they do the 2 day screening, and to our surprise, like two places we did, and out of 80 individually screened, 60 had congenital heart issue. So which lead to another problem, that currently our infrastructure is not really available, where we do the screening, we identify the people, and we are unable to provide them the facility. So it's not that we are not doing it, but there's a lot of things which needs to be done in parallel.
Thank you so much for your answer.
Thank you, Alexander. So there, Erwin, before giving you the possibility to ask, there are a couple of questions or comments in the chat. One from Candy Silversize and another one from Guillermo, one of our fellows. That so your main campaign is in children congenital heart disease, and you are building a children facility. But what is the care or in ACSD patients? In what happened to these patients when they graduate? What is the infrastructure do you have for adult congenital heart disease? If you know the answer.
Farhan, you can let me. I'll let you go first, and then I can add to that.
No, I was about to say that perhaps Ali can you share more.
I can jump
Ali,
in.
you can go.
Yeah, so Candice and I can't remember who else. I think Guillermo, is that right? Somebody else asked that on the chat box. So you're correct. The idea, this is not just a pediatric heart facility that Farhan's trying to build. There will be adult congenital that will be part of this. What's happening right now? That's really the question. And I'll tell you what's happening right now in developed countries like Pakistan, happens in India too, is that a lot of these patients actually are not repaired. They're unrepaired. So a lot of these kids who actually survive, so let's say it's a tetralogy or an ASD or a VSD, because that's really what you're dealing with, that if they get a ASD, VSD, tetralogy repair, they'll survive. They'll go ahead. But there are, if you believe it, and I don't know the prevalence of this, a lot of Eisenmengers, a lot of severe pulmonary hypertension, cyanotic, unrepaired adult patients. So I don't know the numbers on the top of my head, but that is what happens. A lot of these children who don't get operated actually survive in their teenage years, and we actually don't even know what the mortality rate is because we don't know. They probably don't make it. So to that question, that we don't have that degree of ACHD care that we have in developed countries, although it is present in sort of this milder lesions. You'll probably see some of that, but it is very, very poorly done across the country. So yeah, but this facility will be working on that. I know Erwin's hand's been up for a while.
Yeah, Erwin, that's Erwin.
Dr. Ahmad, thank you so much for sharing your very impressive work. This is not only your work, it's this entire team which is behind you, who is making everything happen. And when I think such talk like yours are so important for our community in the high resource countries, so that we know what are your problems in your low resource countries. In our high resource countries, I'm getting older now, and I started to realize we are living in a bubble. The politicians, the mainstream media, we are living in a bubble and are addressing luxury problems in our society. And we don't know the real problem we actually have to survive. And the problem in your country starts at the very beginning, the first day of life. The parents and their children struggle to survive. That's a given in our high resource country. It's like, this is an eye-opener what you have showed us. And such talks are so important that actually Candice also asked her my question. So you're creating a new generation of patients when you are operating these children with congenital heart defects and they need long-term surveillance. You don't cure them, their heart is only repaired. So I hear from you and Ali that there's some structure is in place or will be in place to follow up these patients. So congratulations again, it's very impressive.
Thank you.
Thank you so much, Dr. Edmund. This means a lot. And, frankly, these valuable sessions give us more energy and, we get more focus that, yes, we are on the right track and we need to do a lot. It is just the beginning.
I think it's also our responsibility, the responsibility to make your problems visible in the high resource countries. And you can only do this if we give you a stage to show your problems. And that's our task, our responsibility. Thank you, Rafa, for getting Dr. Ahmad. Very good.
Thank you so much.
So I really wanted to have a platform where you can share. The first time I heard the project, I thought that was impressive, and I think that I really wanted you to have another platform where you could call for help. And my last question is, or my last comment rather than a question is, if it's anything we really sometimes we don't help because we don't know. I think that's exactly that's how I feel. That is not that we do not want to help. Is probably the lack of knowledge of the no, I wouldn't say just only the developed countries. It's just programs like our program that is a very large program. I'm sure we would be very willing to help if we knew. So my last comment is, if there's anything we can do from here, just please let us know. You have my email now, and we will be very happy to participate from education to other areas that you think that we might not be able to give money, but definitely we can do raise campaigns or help with education or any kind of the way of helping that we can offer. I publicly offer it here now, and please just reach out if there's anything we can do. I don't know, Ali, you are mute. I don't know if you wanted to say something. There's another
Yeah,
question.
no. I think there are a couple of other hands that went up, so I just wanted to give other people
Okay.
an opportunity, and
So,
then I'll just give a couple of
perfect.
comments at the end.
Shabib, Shabib, do you have your hand up, please?
Yes. So this is Dr. Shabizadi from London. I'm familiar with this project through Ali and Farhan. It's an excellent project for Pakistan. What I'd like to offer is that we are running an online university called Sadiq International Virtual University, which is based in Princeton, but I'm running from London. And we have participants from across the world. Ali has given a couple of lectures and talks. Would you like to propagate your program through a series of lectures? Because it goes to all the countries, African countries, the Middle Eastern countries, everywhere. And we invite lecturers from different countries, from the West as well as the East. Perhaps it may be an opportunity where you can come with experts in different areas from Pakistan or from England or from USA. Ali can organize it himself and Farhan can help. That might help. It's called Sadiq International Virtual University. And if you go on the webpage, you'll find all the details. Thank you and compliments on this wonderful project.
Thank you, Dr. Zaidi.
Thank you so much, Savizadi. I highly appreciate your offering, and absolutely, I think I'm going to talk to Ali Zaidi, and we are going to plan something where the knowledge sharing and getting to learn more on a structured way. I think that's something absolutely needed. And thank you so much for extending your facilities to us. Uh, I would also like to highlight, Rafa, the point that you have mentioned. I'm very thankful that these forums are what are required right now. I have seen in my 10 years journey, money has never been a problem. Um, I hope Ali is not listening, but yes, money has never been an issue. But to be very honest with you, the main thing is that people understand the cause, and at every level, wherever they can have us speak on the forums, letting the world know that this is something which we really need to do, meaningful, and our focus is that we build something which can be replicated in other parts of the world, like other low-income countries. So thank you very much, Rafa, for this.
My pleasure. So, Ali, I'll
Yeah,
give you.
just a last comment, and I think it resonates with everybody. This is something that's needed, and Rafa, to your point, I mean, certainly this project, there's some work that's being done in Karachi also. Babar Hassan is doing some work in Karachi, so this obviously needs to be done. I think where this really helps is, oops, I think I might have lost you there for a second.
No, Ali, you're there.
Yeah, all I was saying is the point that you initially made, where this helps in this project and others, is really when experts like yourself, Irwin, Candice, everybody on this call sort of become involved. Maybe if there are mission trips or education or teaching on the ground, people over there who learn from your expertise, and then they are the seeds that will eventually grow. That's really where your expertise or expertise around the world comes in.
So we'll be very, very happy to contribute on that, so we can take it offline.
Yep.
And as we say, with that wonderful comment from Ali, that I think we can tell that the congenital heart disease is a community. I think that all of us here are really here to help, and sometimes we forget that how lucky we are where we work in the Western countries, and I really don't want that to. I want really people to realize that if you are born with congenital heart disease, no, your outcomes is not the same with depending where you are born. And from our programs and from countries that have the luxury of not having a problem if you are born with congenital heart disease, I would like to help as much as we can, from giving you a platform for having your voice to even offering myself. I'm sure that members of this call will be very happy to come and educate people. So on that note, thank you very much. First for the wonderful talk. Second for being so persistent in a project that I'm sure that there's a lot of nights that you haven't slept just for this to continue, and it's fantastic to see how the project is going. And congratulations on your work, and to all of you that have attended today. So thank you very much for coming. See you here in a couple of weeks, and good morning, good afternoon, or good evening, wherever you are in the world. Thank you very much. Bye, Farhan. Thank you very much.
Thank you so much. And we have a question from Noman, and I think I just quickly answered it. Yes, Noman, we have adult population data. So thank you so much. We can connect later on. Thank you, everyone. I really appreciate it.
Bye bye.
Have a great day. Yeah. Thank you. Bye.
Bye. Thank you all.